Good afternoon. I'm Phil Owen, a peer recovery coach at Communities for Recovery with the Targeted Response Team. This afternoon, I have a special guest, Jason Howell. He is from Recovery People. Hey, Jason, how are you doing, buddy?
I'm doing well. How are you, Phil?
I'm great, man. So glad to have you on the show. I know you're always busy, and Recovery People is working on so many projects at any given time. I'm really glad to catch up with you, and I'm glad that we have this format to do it so that everybody else can hear about it.
Well, it's an honor. Thank you for thinking of us.
Since I know you a bit, can you just give the audience a little bit of background?
Yeah, Jason Howell. I'm a person in long-term recovery from both mental health and substance use issues, and recovery has been such a blessing. It's allowed me to do things that I would have never been able to do in active addiction. I'm currently the executive director of Recovery People. You can see I've got a little branding on the t-shirt here. We're a nonprofit, a 501c3 that is a statewide network across the state of Texas. And recently we've started doing work in Oklahoma. So we're starting to become regional.
Great. I'm going to share the website here in a second. Can you give us some background on how Recovery People got started? What was the first project? What brought it about?
Yeah. Once upon a time, after I got about 5 years of recovery, I think that many of us along that journey start asking our higher power, what am I supposed to be doing with my life? And as soon as I offered that up, it came very clear back that I needed to provide recovery housing. And so within I used to be a pharmaceutical sales rep, and I called on some of the psychiatrists who I knew were medical directors at rehabs. And so I reached out to one. He immediately said, meet me tomorrow morning at Kirby Lane for breakfast. And from there, we had a recovery home open within the first month. We wanted to open one specifically for the LGBT population, and quickly learned that that could not sustain itself. So we opened up a nonprofit, Soberhood, in order to support that. And then over the years, Soberhood has rebranded itself as Recovery People. We are not a direct service provider. We step more into the infrastructure development role. And that's a fancy way of saying we provide training, technical assistance, certification, and do lots of advocacy. So we're the people behind the service providers.
Great. Well, I'd like to get a rundown of what you guys are doing currently. I'm going to share your website. I know that as a training facilitator and a peer support supervisor, that we're currently working on some projects with workforce experience and helping people get their certification. And I guess we could talk about that. And then if you don't mind kind of giving us a rundown of what Recovery People is up to these days and what all you are working on.
Absolutely. And the website, I will admit, there's opportunities for improvement on the website. We do a lot, so it gets hard to navigate. As I mentioned, our primary things are, training, technical assistance, and then advocacy. And from a target market standpoint, we think about serving individuals and families, or some people would call them customers. We also do workforce development, the recovery workforce, and then also we have programming for providers. The other things on there are just kind of other ways of pulling people into the website. But so some examples of things that we're doing for individuals and families. Currently, we're working on a project that we're calling the Buyer's Guide to Recovery. So many individuals don't know about recovery, or once they are in crisis, they're trying to find services. It's easier for them to find treatment services than it is recovery services. And so once somebody kind of is navigating that world, what are the questions they ask? What is even possible? And so we're hoping to build out that resource, and we're starting with transition age youth first. And then from there, we'll move into different subpopulations. And so we're hoping to have that draft out probably in a month or so, and then get it to our community, get feedback, and then cultivate it from there. I think from a workforce development standpoint, we're focused on two big projects. One is we've had peer recovery specialists for a while. Families can recover as well. And so how do families get family coaching? And so we've actually, through the support of family members in recovery, have developed a family recovery curriculum. We approached the Texas Certification Board. We submitted a proposal, and they've tentatively accepted a proposal to develop an endorsement, a family endorsement that would go on top of the peer recovery specialist. And we have drafted, it'll be a 2-day endorsement training. We've got that drafted and want to circulate it amongst our family members that helped develop this to get their approval, and then officially submit that to TCBAP. So keep your fingers crossed. We're hoping to have that approved and ready to go late fall.
That's such a big support too. I think oftentimes our family members, friends, and allies of the person in recovery get lost in the mix. Al-Anon traditionally has been a support for these families, maybe Codependents Anonymous, but really peer fellowship, real peer fellowship in an all recoveries platform is just lost, because unless you're connected to a school or a church where it's part of their mission to keep these connections together, it just gets lost in the mix a lot. And I think it's one of the strongest supports an individual can have, as well as one of the strongest supports a family can have, is that connectedness, so that both are able to go through recovery together.
You're absolutely right. And I think family members understanding that they can have a recovery process unto themselves. So much, as addicts, we end up, pulling all the energy in. And so family members start focusing so much on how do they get their loved one into treatment or into services that they oftentimes don't think about their own wellness, and realizing they could have a transformational process. Given, addiction is a family disease and there are family risk factors. If we can engage families into recovery, we can impact across generations. So that's really, where we're coming from with this, and are pretty excited about it.
When we think about support nets, and I know for me, when I got into recovery, the more support nets, the better I felt, because for me, recovery had to be like addiction. I had to go into it as full force like I did in my addiction. And to think, when there aren't safety nets for some members of the population, like family members, siblings, parents, where all they have learned over years is, I'm going to, no drugs in my house, or you're out of here, or just these hard and fast top 5 rules that parents thought they needed to abide by to be a good parent, has really, it kept restraints on what the possibilities of recovery could be, I think.
And it's, I don't have children, but I know many of my friends in recovery who are parents and whose children have struggled with substance use, and they say it is much more difficult to be the parent or the affected family member than it is to be the person on their own recovery path or suffering from substance use. And so it's important that we help family members, and the nuance. It's a very complex and confusing disease. And so helping them understand the disease, and more importantly, understand the recovery process can be, really empowering for them, and again, the entire family.
I think bridging that possibility of sharing the process with other parents or their peers gives that platform for everybody to not just learn and get more informed, but to grow from it, and share the successes and perceived failures, in a ride, because it can be quite a roller coaster for anybody.
One of the things that we noticed as we developed this curriculum is just how excluded families are, how stigmatized families are. There is And in our curriculum that we developed, we reach way back, for 2 decades. Family members have been seen as the cause and or undermining recovery, and so they've been excluded a lot in the process. And where we're going now is there's ways of engaging families and helping the family get healthier, and that's really what recovery is all about.
Right. And when I think about family members too, I also think about those of us parents that have lost children to addiction. I lost my son at 22 to a fentanyl overdose, and he had been sober prior to that. And I was actually had started my recovery at that time, and it was the single biggest thing in my life to have to deal with. And the dynamics were completely different for me and my child as opposed to myself.
Yeah. And
You know?
thank you for having the courage to share that. I knew that, but I didn't feel it was my place to bring it up. But I do think, folks hearing that, it's important. Again, the complexity of supporting families in recovery, it's a lot more diverse than peers. We have individuals that span different stages of development. So the affected family member could be, a child or an adolescent, a spouse, a parent. And then also we looked at the different archetypes. If you've got family members whose loved one is still in active addiction versus family members whose loved one is moving into recovery and the changing family system that occurs then. And then as well, we have, family members who've lost loved ones due to addicted related deaths. And that recovery looks different. The types of support that those individuals need, given those various situations, is slightly different. And so our family coaches need to understand that, meet people where they are, and then get them connected with the resources and support that they need.
Great. And it also allows, I think I've done this several times, Peggy Robinson, who for a long time ran our family program at Communities for Recovery, we would work in tandem as often as the participants were willing to, and reconnect peers with their family members and get supports on both sides. And it was always magic for the most part, what we could see anyway, and certainly helpful to watch people reconnect and bridge that gap as they take a new journey.
Yeah. And I should acknowledge that Peggy was one of our family members that helped us create the curriculum that we have. And she was very instrumental in that. And I know that Communities for Recovery does offer some family education programs. And so y'all are ahead of the curve in many ways.
Right. So I see on your website, we're talking about statewide networks.
Yep. So back about 6 to 7 years ago, Recovery People won a SAMHSA grant to develop a statewide network. And so that's really how we see ourselves is, creating these connections across individuals and organizations, because it's these statewide networks that are found to best innovate. And if anything, Recovery People's a social entrepreneurs. We're always looking at ways of addressing difficult problems in innovative ways. So an example of how we're developing networks and partnering with various organizations is through a HRSA grant. We partnered with the University of Texas Health Science Center in Houston, and we call it kind of our peer to career workforce development. And Communities for Recovery is one of the organizations that we're partnering with. When we think of workforce development, so many times it's just thinking about how many people can we get trained? But
Right.
It's getting people trained, getting them connected with their field experience hours, and then getting them connected with employers. And that's the role that Recovery People wants to play. We're centralizing registration, data collection, knowledge assessment, and then decentralizing instruction and field experience. And so that's how we're partnering with Communities for Recovery and so many other partners across the state. We're able to scholarship people through training and also through field experience. And so, for example, I think it was last month, y'all held a peer recovery support specialist training. There's so many different acronyms. And several of the students received scholarships from Recovery People that we pay directly to Communities for Recovery, going through that training. And as they move in and start doing their field experience hours there for Communities for Recovery, we're able to provide some scholarship money that supports making that opportunity happen.
You know, I think it's such a great program you've created, because as somebody that has been training the certified class for a year and a half or so, oftentimes people just focus, like you said, on the training. Let's get them into training. You need to be a coach. Oh, I want to be a coach. Or you know, then there's a misconception of I can be a sponsor and get paid for it, and these kind of things. And you know, you learn during the training that's not what it's about. But they want to connect. People want to give back. You know, once you get your feet on the ground, you get running, you want to give back. But the process often went through the training, and then you were let out on your own. And a lot of times the facilitators, we were the go-to person to try to figure out where to get jobs, how to complete the certification, education beyond the initial class, things like that. So what you've created is really something that kind of eliminates, or is starting to eliminate, the bottleneck of people getting out of the training and not knowing what to do, because it was really hurting cats for a while. Nobody was coming together on job placement opportunities, you know, how to get through it. And certainly just the scholarship itself has been helpful, because oftentimes people need the funds to complete this. And you can get into all kinds of trainings except for peer trainings for such a long time. And you guys have been able to create this. So I'm real happy about this program. Can we talk about how somebody might get connected with it?
Yeah, if you go to the Recovery People website, you're there. Oh my gosh, I think it's going to be under, like if you click on workforce and providers, that may take you to it. I should have tested this. Pace Lawson is our staff person that oversees it. So there's an application online. It should, under one of those, there we go, one up. It says,
One up.
Yeah, it's going to be that second one.
There we go.
Yeah.
I might have a slow connection because we're doing this video.
Yeah. So if individuals go to the site, they'll be able to find an application, and that looks like it there. Let's see.
It there.
Yep.
Yeah.
So they would click that button and apply, and that ends up going to Pace. Pace looks at it and then contacts them to see whether they're eligible for a scholarship or not. And then from there, they get connected with an instructor, and then are facilitated through the process. You know, one of the things that you mentioned, that our approach, no one's had this global view. And so one of the things that we really want to do is be able to see, all right, we have X number of people registering, and then how many of those actually complete the training? Of those, how many actually get certified? How many of those finish their field experience hours? And how many of those actually get employed? And those are all important. There's attrition, but we can find out, so what is it? What are the barriers that's having people fall out of the pipeline? And then we can address those. Right now, we're blind. We have no idea what those numbers are or why.
Right. And I think it's a great thing to look at too. And, you know, we've always talked about who's a good fit for becoming a recovery coach. Well, you know, that can depend on the organization that someone applies for and goes to work for. But I think the class itself is really applicable to so many people. You know, I was a house manager for 4 years, and becoming a coach really helped me work with my housemates a lot. And I know that you've been involved with housing a whole bunch. And is there a housing curriculum for coaches? Is there a housing trade? Working house managers or people that are working with a sober house or recovery residents, what kind of training can they get to help in their role?
Thank you for bringing that up. Yeah, that's you know, I started in recovery housing on this journey, and so that's a big part of my heart. And it's hard. A lot of times people get, you know, they get somebody points at them and says, "Okay, you're house manager today,"
Right.
and they don't have any formal or informal training. So a couple of years ago, we, through a HRSA grant, we developed a really robust uh, uh, recovery house manager training. The problem was that it's really it was expensive. It was about $2,000 per student, and it included a retreat. I mean, it was nice. When you have government funding, you can do something like that,
Right.
but most people can't afford that. So what we've recently done is created a one-day fundamentals of recovery housing, and it really focuses on social model recovery and how a recovery house manager would apply that within the home. We've provided that training a couple of times in Oklahoma. The state of Oklahoma has really invested a lot in recovery housing, including training and technical assistance. So we're doing most of our work in recovery housing there. We did, or were able to provide that training at our Recovery Capital Conference, which we had there in Austin a couple months ago. And Communities for Recovery provided a lot of volunteers helping us set up and break down. So thank you for that. Of course, now we're in the age of COVID, where everything's moving online. So we want to provide that that training. I'm working with Elizabeth Henry, who's one of our staff that's over that particular project. We're looking at June as a potential time to have a virtual recovery house manager training, or what we call the fundamentals of recovery housing. So be looking for that this summer.
Great. Well, I want to get a chance to talk about advocates and policymakers, as I see that's on your side as well, because we all know that recently Texas has embraced Medicaid billing with regards to peer supports.
Right.
It was a big push from our policymakers and our. Can you explain what you do as far as policy development and participation in our state level?
Absolutely. A big part of what we do is advocacy, looking at, so what are those policies at the local, or really kind of at state and federal level, that are barriers to us getting the services that we need. And at the Texas level, we were very fortunate that we won a Hogg Foundation Peer Policy Fellow. So we have a full-time staff person that is focused in on advocacy. His name is Carl Hunter. And the way that we met Carl is he was a speaker at one of Communities for Recovery's events. And so again, there's that connection between Communities for Recovery and recovery people. So during the last legislative session, we worked with our legislators and had three potential bills moving forward. We ended up getting two of them submitted. One was a recovery housing bill that would have developed a report on recovery housing and set us up for future funding around recovery housing. That bill passed the House and made it all the way to the Senate. But in Texas, if a bill doesn't pass within that 140-day window, then it dies and has to get resubmitted next session. So we had that recovery housing bill moving forward, and we also had a rural RCO bill that also passed the House and made it to Senate committee before it ended. We're in Texas, our state legislature meets every other year, every odd numbered year. So we are in the off season right now. They call this interim session. But in January of 2021 will be our next legislative session, and we plan on supporting, giving legislators some ideas of like what would be some really good bills to push there. It is a just because our session is open every other year doesn't mean that we stop advocating.
Right.
So, for instance, that recovery housing study bill didn't pass, but I am on the Health and Human Service Behavioral Health Advisory Committee, and so we have a housing subcommittee that I work our chair, and we submitted a proposal. Essentially, it was a very similar proposal to what the law would have been to Health and Human Services, saying that they should come up with their own housing choice strategic plan. They like the idea and they're implementing it. We are currently working on that study. It would look at housing needs for individuals with mental health, substance use, and or intellectual disabilities. And we're hoping that that report comes out fall, and then advocates can use that paper to advocate for different housing policies. Trying to think of some other examples. You mentioned, peer services now being Medicaid billable. We were a big part of that effort. That was 1486 was the bill, and then also participated on the work group to write the rules around that. I'm trying to think of some
I think we oftentimes lose sight of what it takes to get a bill passed. It's not just a great idea, crafting and writing a bill, but there's a long travel to get it there.
Yeah, it's definitely it's a long game. And I tell people all the time, if they're interested in advocacy, they're the folks that we need to show up at rallies and really kind of raise awareness. There are folks that we need to kind of write letters. If there's if they live in a particular district and they like a policy idea, they need to have a great relationship with their senator or their representative and their staff. And so if a bill or an idea comes across their desk and it has anything to do with addiction or recovery, then they need to think, oh yeah, there's that constituent of mine that is in their computer system. Maybe I should reach out to them and ask them whether this is a good idea or bad idea. The recovery community, I mean, we're large, but a lot of times we keep our voices quiet. So when there's opportunities to reach out and develop these relationships and advocate for specific policies, I encourage people to do it. And then if you are an advocacy warrior, then there's a lot of room for that. Currently we are working with the Texas Association of Addiction Professionals, as well as the Association of Substance Abuse Programs, ASAP. We collaborated and had ABCs of Advocacy events and Recovery Day at the Capitol. And currently we're working on a document. We want to develop a communication plan and a message. How do we explain to our lawmakers that we really need a comprehensive solution? One, recovery is possible, but we need to set people up for success. Yeah. And so how do we explain that the kind of the bigger picture? And then as each one of us go in, we can say, this is what's needed, and here's the particular part of the solution that I want to talk to you about today. It's a tricky wicket because we're having to frame the big picture and then go in with a specific policy recommendation.
Yeah, and I think sometimes, as a recovery population, we oftentimes distance ourselves from the population at large because of sometimes just recovery languaging. And certainly when you talk about policy has its own languaging as well.
Yeah, it does.
Always mesh immediately, so, building momentum and getting those languages to mean the same thing. And it's a big process.
Yeah, I think, a lot of people struggle with how do they advocate with anonymity. And so, if you talk about if you notice at the top of this, I said I'm a person in long-term recovery. I didn't mention whether I was part of any fellowship or not. And so that's an example of how you can identify yourself as having lived experience and some credibility there. And then it's that language piece. I've seen a lot of people testify before a committee, and a representative or senator be really interested in it. And it's like, so what helped you? What made the difference? How were you so successful? And individuals start using language that they would have maybe used within a 12-step room, or they would talk about, what changed my life was a belief in the higher power. Well, that's great, and that could be a really big part of their recovery journey. But as a lawmaker, they hear that and they're like, okay, well, that just means somebody goes to a 12-step meeting or goes to church, and we don't have to spend money on addiction. So learning kind of like who's your audience, and when you have those opportunities, being able to say, well, what really matters is we need to get people connected with the services they need. whether that be detox or, into treatment, into recovery housing, into recovery services, and be able to just get that rolling off their tongue.
Do you think recovery, the recovery population would benefit more from using more of a wellness language? Would that speak to the community at large better, do you think? Or
so I think we really need to think about our language. When we're in certain fellowships, there's a shortcut language that we use that everybody knows what it means when you're in the bubble, and then you say that outside of the bubble and people are like, what in the world are they talking about? So we really need to think about wellness. There's some debate back and forth. Do we frame this as a disease, just like any other chronic illness? That's the thing that we're ASAP, TAP, and recovery people are working on right now. What is that language that we can all commit to that not only means something to us, but means something to those lawmakers?
Right.
And we're hoping that once we get this document, we can share it with, folks that are either, working on the treatment side or working on the recovery side. And repetition is important. If those legislators, if those policymakers hear the same language over and over again, then they realize what a large population we are. And hopefully it's in a way that they can hear it and take action upon.
Yeah, I agree. I enjoy being part of the secret handshake club, but I also, to benefit ourselves as a whole, we do, I think, need to learn how to speak to that. Know your audience, if you will. I think it's so important. And we certainly know our audience here, and I appreciate everybody tuning in to Recovery Talk. Jason, Howell, I always learn so much when I get some of your time. Thank you for spending some of your time with us, and thanks for being on the show.
Yeah, I would definitely if you want me back, I'd love to talk about more of the stuff that we do around our recovery incubator, certifying recovery housing. We kind of touched the surface of everything that recovery people is.
It's the beginning of an ongoing conversation, but I do have one last question for you.
Yeah.
If you could create a flavor of ice cream, what would that be?
I really like Mexican vanilla.
Hey,
I don't think you can improve on that. Maybe it's takes me back to my childhood down in South Texas, and my grandparents. I don't know, but if I'm going to eat ice cream, that's what I want.
There's nothing wrong with the classics. Carlos Corrado, when he spoke of his favorite ice, his was hand cranked homemade strawberry ice cream. And that certainly brings back memories to me, and so does old-fashioned vanilla and Mexican vanilla. But thank you so much for being on the show, and we will continue this conversation in another episode.
Excellent. Take care of yourself.
All right. Thank you so much.